Okay, so we're gonna spend a few minutes going over this report. Before we get into the substance of the discussion, though,
Okay.
there is no right or wrong answer. There's never been a study in the history of urology that has proven that one treatment is better than the other, and because of that, you're not going to hear me say to you, Mr. Reese, you should do X, Y, Z, because there's never been a study to prove that one treatment is better than the other.
Mm-hmm.
Because there's never been a study to prove that, you have to make a decision that's best for you, your family, as to how this disease should play a part in your life. In other words, everybody wants survival. Everybody wants to live a long time. Mm-hmm. However, I would also say to you, living long means nothing without quality of life. And so you certainly want both of them, okay? Mm-hmm. So as you hear what I have to say, just look at both of them. Mm-hmm. As I started this discussion, what we found is not going to impair your longevity of life. If it's in your cards to live to be 110, you're still going to live to be 110, okay? Mm-hmm. So here's the report. It said Mr. Isaiah Reese, date of birth is 7/13/1949. This is the schematic depiction of your prostate, the left side, the right side, okay? These are benign, and rectangles like that are malignant. And so there's one area right here on the right side that shows an area of malignancy. And if you read that description, it says adenocarcinoma of the prostate, small focus, a Gleason score of 6, 3 plus 3. Okay? Now, what does Gleason score mean? Think of prostate cancer behavior on a scale of 2 to 10, 2 being good acting and 10 being very aggressive. Mm-hmm. We consider anything as 6 or less as a good acting cancer. Anything 7 or greater is much more aggressive. How the pathologists come up with a Gleason score, what happens is that he looks under the microscope and he sees different patterns these cancers make. It's almost like looking at 5 different kinds of flowers. A rose looks different from a tulip, which looks different from a daffodil. The same thing applies to these 5 patterns. This is pattern 1, 2, 3, 4, and 5. So what the pathologist does, the first question he asks is, when he looks under the microscope, what do I see the most of? In your case, he says, I see pattern 3. Then he says, what do I see the second most of? Oh, I see the same thing. So that's where you get the 3 plus 3 equals 6, okay? And if you look at the Gleason score 6, that falls into the lowest grade group. So you're in grade group 1. If you look at 5-year PSA failure-free survival in grade 1, you're talking about 97%. I will tell you 10 and 15-year data also suggests, regardless of what you do, in 5 to 10 years, or 10 years, you're still talking about 85 to 90% of patients in your category will still show no evidence of disease. So the prognosis for this cancer in you is very, very good. Okay, so with that being said, we're gonna talk next about your prostate cancer risk stratification, because that question will come up as you read and become educated. This is a copy of a book published by the American Urological Association, the same group that board certifies us as urologists. And it was put out to serve as a patient guide, to help patients and their families to be able to understand this medical terminology. And if you flip forward a few pages, it reiterates what we just talked about. The most common grading system is the Gleason score. These scores goes from 2 to 10. 2 to 4 is low aggressiveness. 5 and 6 is more aggressive than 2 to 4. Gleason 7, 8s, 9s, and 10s are the most aggressive, and you have a 6, as I just showed you. Okay. Your stage of your cancer is a T1C, and if you read this by definition, it says tumor identified by needle biopsy because of an elevated PSA, and as you know, your PSA was 5.75, okay? Now, when we look at what we call your prostate cancer risk stratification, this was a scheme put together by the American Joint Committee on Cancer. And this is after they reviewed tens of thousands of prostate cancer cases from around the U.S. And when they did that, they identified 3 risk factors that make people die from prostate cancer. If the PSA is greater than 10, that's a risk factor. Yours is less than 10, so you don't have that one. If your Gleason score is equal to or greater than 7, that's a risk factor. Yours is 6, so you don't have that one. And if your clinical stage is greater than T2A or T1C, so you don't have that one, the number of the above risk factors you have is none, and by definition, it makes you have low risk prostate cancer. Another way to think about this is something else that's probably going to take you out of this world before this will, okay? So that's the way I would think about this. So in terms of your options for treatment, the first option is doing nothing at all, or observation. Another term you'll hear is active surveillance, and I have an article about active surveillance here, okay? And so if you choose to do nothing at all, it means that you will have to get a PSA checked every 3 months, and then usually right around a year to a year and a half, depending on what happens with your PSA, we would recommend a repeat biopsy at about a year, year and a half, and that's called, active surveillance, okay? Hormonal therapy, which is the next option, is generally reserved for people that have advanced disease. If you had high risk, you don't have high risk, I just showed you have low risk cancer. The third, fourth, and the fifth options are the options for treatment if you choose to have treatment. Now, before we get into this discussion, you have a fruit fly here, and you want to kill that fruit fly, and you got 3 types of ammunition. You have a shotgun, you have a pellet gun, and you got a BB gun. Now, all 3 of them are going to kill the gnat, right? But which one is going to cause more collateral damage?
The shotgun.
The shotgun. So, in this case, the going in to cut out the prostate is going to be the shotgun. It'll take care of the gnat, but and that's essentially what you have in your prostate is a gnat. It's going to kill it. But on the other hand, your collateral damage is going to be much more so, okay? And what collateral damage are we referring to? One is loss of control of water, which is incontinence, and that can happen in 10 to 12% of men. But particularly in a man your age, you're probably talking 20 to 30% in a man your age. And then the second side effect is erectile dysfunction, and more than 50% of men your age will have some significant erectile dysfunction. That's where the discussion comes in with you and your partner and the others and people that may have a voice in your life. But if you were my father at 71, my husband, brother, that's not what I would recommend, okay? But again, choice is up to you. The next option for therapy is radiation therapy, and specifically radiation seed implants. And this little thin pellet there, right there, you see it? That's a radiation seed implant. And the way that is done, and by the way, this information talks about radiation and the types of radiation. External beam radiation is like laying on a table taking a chest x-ray, and internal radiation are those seed implants. The way these seeds are done is through an area underneath the sac. These seeds are placed strategically in the prostate as shown here, and that takes care of cancer. In the scenario we talked about earlier, this would be the BB gun. It's going to take care of the prostate cancer, but your collateral damage is going to be minimal. You're talking about less than a 1% chance of incontinence and erectile dysfunction in the range of 10 to 20%, okay? And then finally is cryosurgery, which is freezing the prostate. And using cryo, you have 2 approaches. Total freezing, meaning you freeze both sides of the prostate. And if you do that, this becomes the pellet gun, okay? Meaning that the incontinence is going to be very similar to radiation seed, less than 1%. However, the erectile dysfunction is going to be very similar to the radical. That's why it's a pellet gun. So it causes a little bit more damage than this one, but not quite as much as the radical, okay? However, now the other way we can do this in your case is what we call the hemi-freezing. In other words, it's learning from treating breast cancer in women. Instead of taking the whole breast, we take just the lump out. We can freeze just the side of where your prostate cancer is. And if we do that, now all of a sudden it too becomes a BB gun. You're talking about less than 1% chance of incontinence and only a 10 to 20% change in your erection. Okay? The only drawback with doing a hemi is because we're only freezing in half. It can occur, very small percentage, but it can occur on the other side. We would monitor that as we would monitor all of these by checking your PSA, and if there's any evidence of reoccurrence or the other side getting cancer, we would certainly go ahead and intervene.
Mm-hmm.
And then finally, I'm about done. I know you may be in a hurry.
No, you're fine. You're fine.
And then finally, all of this stuff leads to taking care of the acute situation. Mm-hmm. Your long-term survival is really tied to your immune system. And so how do we go about achieving a strong immune system? You have to achieve and maintain a healthy weight, be physically active, and eat a healthy diet. What is a healthy diet? You need to get rid of or avoid the beef, the pork, the processed food, that's bologna, that's hot dogs and stuff like that, sausage.
All the stuff we love.
All the stuff that most men like. And dairy products. And dairy does include ice cream. Most men, I still eat my ice cream. No, you can't. You can use other plant alternatives. They make an excellent almond ice cream and soy ice cream. So you got all of those things. The same thing you can get in dairy, you can get that's plant-based. And that's what you need to do. In addition, if you didn't check your vitamin D, there's a direct correlation between vitamin D deficiency and development of prostate cancer. So the other thing about vitamin D is that it also provides a protective effect against COVID-19. And so the higher your vitamin D, the better you want to be in terms of trying to deal with COVID. These are the other things, foods and things that will also help improve your immune system. I would strongly encourage you to try to do this, particularly with turmeric. Turmeric also is very important for inflammation associated with cancer, but also it has a protective effect against COVID-19 as well. Mm-hmm. Any questions, guys?
Oh boy, there's a whole lot of stuff going on. I'm telling you.
Well, I don't want you to even attempt to make a decision, or I want you to go home and read and become educated before you make a decision. If I were you, I think and I normally don't give you my opinion at this point, but the one thing I will tell you, and there are a lot of urologists who will take your prostate, cut it out in a heartbeat, even if you're 80, 85. Yeah, I'm not that kind of guy. I will tell you not to get a radical. Absolutely. If you're my father, grandpa, that's not what I would do. But I think if you're going to do something beyond observation or doing nothing, I would either look at the seed implants or the freezing half of your prostate.
How do the seed implants work?
They give off radiation over a period of time, usually 3 to 6 months, but normally with you it'll be iodide, which is the type of seed that is used. And then after 6 months, it becomes dormant, but you will see your PSA gradually coming down.
But what I'm saying though, is this some type of procedure?
It's outpatient. Like yes, sir. You come in, we put you to sleep, we put the seeds in, you wake up, you go home.
That's what Rod got.
That sounds like something I'd rather look at, something like that.
Well, read it. That's why I'm giving you all the information. That's why I took the time to go over it to make sure you understand. And everything we talked about is in this information, okay? Any other questions?
What's the likelihood of reoccurrence after the seed?
Yeah, you're talking 7-8%. Any cancer can come back, and that's a good question. Any cancer can come back. After a radical, even if I were to go in and cut it out, and I say all the cancer was removed, Mr. Reese, and even in that situation, you got about a 5 to 6% chance of cancer coming back. So after the seed, you're talking 7-8%. So it's not a significant difference. Okay. Any other questions?
With the seed implant, is this something you have to do?
Just one time.
Just one time?
Yes, sir.
Okay.
That's my phone ringing. I'm not looking at my phone.
No, that's no problem.
But I think it sounds like something I would rather go through,
Well, read about it. I mean, you and your family, y'all talk about it, and then y'all come up with the decision.
Okay.
You might want to report that to the VA too, because there's a correlation between exposure to Agent Orange and development of prostate cancer. So that should be service connected for you. Okay?
Yeah.
Any other questions?
Not right now.
Not right
So when if I decide to do this seed implant,
What's going to happen? You're going to come back here in 10 days to 2 weeks. I'll give you more than enough time to read and become educated.
okay,
Then you all write down any things you don't understand and any questions you have, and we'll go through it at that point.
okay,
Okay?
all right.
Very good.
Sounds
Where are
good.
you at, Emily?
I'm at Midtown in
Where?
cardiology.
Cardiology. Okay, that's why I got to see you over there. You
No, I'm a program manager.
Program manager?
Yes, sir.